Thanks for joining us. Last year, we provided a series of YouTube videos to help you understand and navigate the PQRS and value-based modifier programs. Most of that material is still useful, but it's important to understand that the programs are updated each year. In this session, we'll focus in on new requirements and new tools to help you with the 2015 requirements for these two programs. As you know, Medicare has instituted a number of quality programs, each of which started out providing bonus payments, but which have now moved into the penalty phase. PQRS and value-based modifiers are two of these programs. The penalties have grown. The impact happens 2 years in the future. Some of you may be seeing reductions in your Medicare payments today because you didn't attest for meaningful use or report for PQRS back in 2013. What you do or don't do this year can result in penalties of as much as 9% in 2017. Let's look at what's new about PQRS in 2015. First, there's no more bonus payments available for this program. The penalty stays the same at 2%, just like in 2014. But now you must report 9 quality measures across 3 domains instead of the 3 measures required in 2014. In addition, one of the 9 must be from a list of 19 cross-cutting measures. CMS believes these apply to all providers who see patients in face-to-face encounters. If you don't see patients face-to-face, such as a radiologist or a pathologist, you're exempt from this last requirement. If there aren't 9 measures applicable to your practice, you must report as many as possible. The same reporting options exist for 2015 with a few changes. You can report the same quality measures for meaningful use and PQRS as long as you are using a 2014 certified EHR, and that EHR can produce an electronic file that can be uploaded to CMS. The quality measures you report must utilize the 2014 version specifications. You can also still report via measure group. However, 5 of the 2014 measure groups have been retired, while 2 new ones have been added. Additional measures have also been added to some of the groups. It's important to understand that the measure definitions can change year to year, so you want to be sure that you're reviewing all the details using the 2015 measure list and specification documents. To access these, visit the CMS website and click the Measure Code option on the left-hand side. Download the measure list and the 2015 supporting documents. The PQRS measure list has been revised and it's much more helpful. You can open this in an Excel file where the small arrows allow you to filter on any of the columns. CMS has provided the CMS measure number, which is used in meaningful use, and the PQRS measure number to make cross-referencing much easier. They've listed the domain here for you as well. In addition, they've also listed which reporting options you can use this measure with. This is particularly important to CMS as they have reduced the number of measures that can be reported on claims. You definitely want to confirm that the measures you are considering reporting can be reported using the approach that you've selected. The supporting documents is a zip file which includes several files. The largest of these has 2 to 4 pages of text for each of the 250 or more measures available to report by claims or registry. The Release Notes document is useful to quickly review changes in any of the measures from 2014. Use this to see what's different for the measures that you reported in 2014. The QDC Categories document is particularly helpful in confirming exactly which QDC codes will count as meeting performance. For PQRS reporting, all measures must have a performance rate greater than 0%, meaning that at least one patient you report on meets the performance criteria. But for value-based modifiers, it has become increasingly important that the performance rate be as high as possible. Finally, CMS has given us a new tool with suggested lists of measures that are applicable to these specific specialties. There's no requirement that you use these measures, and if your specialty isn't listed, this doesn't mean that you don't have to report. These are just some helpful tools you can use if you choose. There are important deadlines for the PQRS programs that you need to be aware of. As in 2014, you still have the option of reporting quality measures either as individual providers or as a group. If you report as a group, you'll need to register your group with CMS and specify how you'll report these by June 30th. This is significantly earlier than what was required in 2014, so it's important to be aware of this new deadline. You'll also want to keep in mind the submission deadlines. If you report via claims, the QDC codes need to be added to the same claim as the qualifying service, so you'll be doing this all year long. But all claims must be submitted to CMS by February 28, 2016. If you report through your EHR, the file must be uploaded to CMS that same date, corresponding with the attestation deadline for meaningful use. Registries and qualified clinical data repositories have a deadline to submit data on your behalf by March 30th. They will likely have an earlier deadline for you to submit your data to them. As a summary, we've included a slide of reporting options for an individual provider and another for reporting as a group. You can find more details about the PQRS requirements and about each of these reporting options by reviewing our YouTube video series distributed in 2014. Part 2 of our presentation today relates to the value-based modifier program. For practices with fewer than 10 providers, this is a brand new program in 2015, and many medium-sized practices may still be learning exactly how it works. We'll cover a few basics here, but I would urge you to watch our 2014 YouTube series on value-based modifiers to get more details. For practices that do not elect to join accountable care organizations, the value-based modifier program is Medicare's approach to pay for performance. Under this program, a practice's Medicare payment rate will be adjusted upwards or downwards based on how you compare to your peers on cost and quality. The cost portion of the equation will come from CMS analysis of your claims data. The quality portion comes from the quality measures that you report through the PQRS program. If you don't report any quality measures or don't report sufficiently to meet the PQRS requirements, you'll receive the same payment rate as if you had the lowest quality and highest cost. CMS estimates that about 85% of practices are expected to fall in the white boxes. The increases and decreases in payment are designed to hit the practices that are outliers. We're in the middle of a phased implementation. Large practices with 100 or more providers started this program back in 2013, and they're seeing the first impact on their payments this year. Practices with 10 to 99 providers started in 2014. In 2016, they can earn a higher payment rate, but they won't have any downside risk. If you're in this group, how you perform on the quality measures you report for PQRS in 2015 can result in either higher or lower payments from Medicare for 2017. For practices with less than 10 providers, your first year in the value-based modifier program is this year, 2015. You'll have the potential to earn a higher payment rate in 2017 based on what you report this year, but you won't see any payment cuts until 2018, and those cuts would be based on 2016 data. This slide shows how much is at risk based on what you do in 2015. Practices with 10 or more providers can get a penalty of as much as 4% from the value-based modifier program. If they don't report PQRS measures successfully, they would see this 4% cut plus a 2% penalty for PQRS. Similarly, practices with less than 10 providers could potentially get a 2% value-based modifier penalty plus a 2% PQRS penalty for a total of 4% in 2017. Note that under this program, there is a set penalty percentage, but not a set increase. The program is required to be budget neutral by law, so the dollars paid in higher reimbursement must equal the dollars saved through penalties received by other practices. In order to understand how you compare to others on cost and quality, you'll want to access your Quality Resource and Utilization Reports, or QRUR. This is a detailed report, including patient-level data that allows you to see exactly how your data compares to national norms. 2013 is currently the most recent year available, but a mid-year 2014 report is expected to be available this summer. To access the reports, you'll need an IACS login and approval from your security official to access the feedback reports. If you have more questions about the Value-Based Modifier program, please watch our introductory YouTube series released last year. You can also get more information about all the Medicare penalty programs at the link shown here. For those of you that would like additional assistance, we offer a standard consulting package that covers the PQRS and Value-Based Modifier programs. We'll provide detailed requirements and timelines specific to your unique situation and recommend approaches and measures that are customized for your services and size. The standard consulting package includes a 1-hour presentation to your practice leadership and key staff. Additional consulting services can be designed around your needs, including development of a comprehensive implementation plan, customized workflows and data capture tools, or staff and provider training. Just give us a call to discuss your specific needs.